Core vaccines are given to puppies and adult dogs to protect them against highly contagious and potentially fatal diseases. Here in Australia, the core vaccination is for canine distemper virus, canine adenovirus, which causes hepatitis, and canine parvovirus. They're combined within a single vaccine, commonly known as the C3 vaccine. Fortunately, widespread regular vaccination of our dogs over the past 5 decades has resulted in the control of these deadly diseases. But outbreaks do still occur. That's why it's so important to ensure your puppy receives their first core vaccine between the ages of 6 to 8 weeks of age and avoids public areas where other dogs may have been, such as dog parks, until they've had at least their second and, in some cases, their third puppy vaccination at 16 weeks of age. Your vet will be able to advise you on the best course for your puppy. Boosters are then required every 1 to 3 years depending on the type of vaccine. You may have also heard of the canine cough vaccine, which provides additional cover against Bordetella and canine parainfluenza virus, commonly known as the canine cough. This one's given as a booster every year for life. Most boarding kennels, doggy daycare centres and some groomers will require your dog to be up to date with all of these vaccines. Canine cough is an airborne disease that's highly contagious and commonly found where dogs are in close proximity, like kennels and dog parks. It's treatable, but symptoms such as coughing can linger for several months and be particularly debilitating in the elderly, with other respiratory or cardiac issues. So keeping up our vaccination rates and therefore herd immunity in dog populations across Australia is vital. As a vet, I do find owners allowing their dogs' vaccinations to lapse, or some may have concerns over the potential adverse effects. And my advice, like that of the World Veterinary Association, is that the benefits of protection from potentially infectious disease far outweighs the slight risk of a vaccination reaction. These days, we also have the option of Titre testing, where a blood sample is collected from your dog and the antibodies to a particular virus are measured. It determines the level of protection and whether a vaccination booster is required. As their guardians, it's up to us to protect our pets from all preventable pain and suffering. Vaccine provides this cover not only for our own pets, but for our community. Talk to your vet to ensure your dog's vaccinations and parasite protection are up to date and specific for the area you live in. What do you think, Monty? I think we're all up to date, aren't we? Thank you.